Hi, Dr. Medhat. Yeah. First of all, could you do a brief introduction for yourself?
Okay, I am Dr. Medhat Samir. I'm from Egypt. I graduated 2010.
Okay.
I am a general dentist. My specialty is in restorative and full mouth rehabilitation.
Okay.
I am using magnification from day one, from my first practice.
Wow.
Starting from dental loops.
Okay.
Then I'm shifted to a dental microscope 9 years ago.
Okay.
In 2016.
Good.
I'm doing all my practice under microscope, by the way.
I see, I see. So today we have a summit about the prevention under the microscope.
Yeah.
So
the lecture is very interesting.
Thank you, thank you.
Yeah.
So could you share a little bit more with your experience using the microscope with the prevention?
Okay, microscope for prevention. It's an amazing tool as I can see and make my patient see to what I'm seeing.
I see.
This is always the issue, the miscommunication between doctor and his client or his patient.
Okay.
That the doctor is seeing a lot of things and his patient, he can't imagine what I'm seeing. When I'm telling him there is a tiny incipient caries appear enamel or hypomineralization. What? It's okay, doctor. It doesn't hurt me.
Okay.
Always the patient, especially in Egypt, came to the clinic when they are in pain, and this is one of our issues in Egypt. That the culture doesn't. Our culture, the prevention of dental diseases is not deeply present in our culture.
I see.
We went to the dentist when we are in pain.
Okay.
If you tell a patient, go to the dentist for a checkup, why? I'm not in pain, so I don't need to go.
Yeah, same.
So if I'm doing a regular checkup or something, I'm telling the patient, you have gingivitis and you need scaling, you need a caries removal, and he's not in pain. He thinks that I am wanted to do some work to take money from him.
Yeah.
But under microscope, he's seeing everything magnified, clear, and live streamed.
Yeah.
So he became motivated.
Okay.
Like doctor said today, I motivate his dental IQ. I raise his dental IQ.
Yeah.
So my clients who started to come for me from 2016, now they ask for prevention now because they are trained.
I see.
Yeah, doctor, I want to check up because I don't want to do this full procedure again.
Okay.
I don't want to do root canal or crown or whatever. Yeah. So that microscope help in the motivation of patient too much. Yeah,
I see.
That's true.
Yeah, so your maybe opinion that microscope help you to communicate better with the patient?
Too far away, better than before. Yeah. Much better than the intraoral camera.
Okay.
Because the intraoral camera, I love it. And it helps a lot.
Yes.
But it tells the patient this is the issue, and you remove it. He doesn't see an interaction you can do with it.
Okay.
When I'm telling the patient this is incipient caries, I can't see it as a caries. When I'm showing him under microscope that is with probe, it is excavated.
Okay.
Okay. Oh my God, this is soft. He is I'm working. It is live streaming.
Yeah.
This is a big difference.
Okay. So yeah, you're right. Because camera is you only show maybe the result or maybe before
and after only.
That's it.
Yeah. Most of my loyal clients who's knowing me, they asking me to adjust the screen. Sometimes the microscope blocks the screen and they can't see.
Okay.
You know the microscope, he is supine position and the microscope is over like this.
Okay.
Sometimes he can't see.
Okay.
No, doctor, I want to see what you are doing. He's enjoying. So the the new VR goggle you are providing in IC is amazing. I told Peter yesterday, it's amazing, really. It's the VR that the patient, whatever in any position, he is seeing what I'm doing. It is not related to a screen. So he's wearing the glass, and sometimes in complicated procedures, I need to make the patient ultra supine position. His leg is up and his neck is down. And I work with 3 assistants. This is 800 dentistry, and all of them is over him. So it's like operation, like operation microapical surgery or something like this. The patient, he can't see.
I see.
With this glass, he's like in a cinema. He's alone with what we are doing or watching it live.
Sure. I hope that maybe we can. We will launch that. You can use that as soon as possible.
I will buy it immediately when it comes. I really.
Thank you. Yeah, thanks for your insight about ortho microscope. Because this is I would say maybe it is not so common to have ortho dentists using microscope right now. So what you see maybe could be the challenging for them, or why they just don't adapt to microscope.
This is a good question, by the way. The microscope issue, we call it the microscope issue, is first, it has a steep learning curve. Dental loops, you can buy a loop and you start working from day one. While microscope, no, you can't work it from day one. You need a training, you have to be patient, and so on. My professor, Dr. Ashraf Rifai, told me when I brought the microscope, if you use the microscope from day one, as there is no other option, you will suffer, but you will get used to it.
I see.
If you, this is a tough case, keep it away, and then you do is regular, then I bring it back. You will never learn it. So most of dentists, his concern is to finish the case, not to learn how to use microscope. Especially when he accepts too much patient per day. He meet like more than 10 to 20 patient per day, and this is the workflow in Egypt. Work like this.
I see.
But the microscope needs to reduce your client per day, because you need to take your time in work. You need to take it at least 1 hour for work. To start the microscope, and this is my advice for every dentist who is going to buy a new microscope, if you give your patient 1 hour for regular procedure like composite, endo, or whatever, make your schedule, instead of 1 hour, is 1 hour and a half.
I see.
Because give yourself a time for learning. Give yourself a time to get used for the microscope. Unless you do this, you will never learn a microscopic protocol.
So your advice.
Second one, do a lot of scaling.
Gotcha.
Scaling and polishing with microscope is very, very, very complicated, by the way. It's not that easy. Like we do it without microscope. But with a microscope, you learn. You have to work on each side. From buccal and lingual, from occlusal. So you face all sides of the mouth. So scaling especially trains you well. It shows you how to work in the lower lingual, which is one of the hardest positions for the microscope. With something that is not too, let me say it properly, too aggressive. It is not a like pear. You will not cut the tooth away. It is just a scaler or air pressure. If you directed it improperly, you will not do a permanent harm. Like blade or contra, you will do permanent harm for tooth or soft tissue. So scaling and polishing with a microscope is the key point for training.
I see.
Plus doing all the procedures. Second issue of the microscope is its price. Regarding the Middle East, the Middle East area with financial issues and low economical incomes for the patients and doctors. So the doctor cannot buy a microscope and reduce his clients and increase his price. So the patient will not come and so on. Usually dentists who do this, like I did, he take a risk. All my companions told me when I bought microscope in 2006 and raised my price triple immediately. Oh my God, you are insane! But if I didn't do that, I will not work.
I see.
And actually, it took me 1 month. No patient came. All patient come. What's this price? No, I will not do it. He will go away. Then with time,
I see.
A highly motivated patient from my clients and the new clients came. Now my patients came to me, and if I'm not exist, asking me if another one will do the procedure, we want him to do it under microscope. Dr. Medhat will not work. Okay, I have no problem, but he must use a microscope.
I see.
So my patient highly motivated for microscope now. It's 9 years. It's a good number for me.
Good. I think maybe your advice is like maybe dentists should be more patient with the microscope, because maybe starting is not that. It is not easy to learn. It is not easy to start from day one, but with patience, you will get it. Once you get used to that, I mean, you
will never use your work without it.
And also your patient is more connected with you, because if you give them a better
now my patients is let's say they are putting the treatment plan with me. They know the steps. Sometimes my patients are joking, like in endo, I'm saying, bring me sodium hypochlorite. Before I'm saying it, my patients sometimes say it. Sodium hypochlorite. I know it. I'm telling them, you are becoming, now you are a dentist like me. I will compete you. Dentist is a family medicine. You meet father, mother, child.
Exactly. They're referral.
It is community. It is not one patient oriented. It's a family oriented.
Exactly.
So he came to me, do his teeth, son. He bring his wife, and he's watching and he's enjoying. I am watching now, not in that dental chair. I am in the couch, drink coffee and watching what you are doing for my wife. So on his kids. So no, the microscope really made a big difference for me in my practice, in my communication, in my raising my skills. Reduce the amount of reduce the number of patients I see, but raise the quality. The quality vs quantity. Now it is not a quantity issue; it is a quality issue. Quality time, quality regarding pricing, quality regarding the end product I give to my clients, and they are really appreciating it.
I mean, your insight about microscope is really great, because encourage maybe all the people or the dentists try to use the microscope, which is very good. So maybe in your opinion, so can you give some advice to us, to KP, about microscope? Regarding
the Middle East? Regarding the Middle East, the Middle East first issue and the first challenge for many dentists to start using a microscope is the pricing. Let me say it clearly. Price make dentists choose between product and other. Maybe this product give me a higher quality than this, but I will choose this because of money. Because I can't afford this. And that's why the Chinese brands take place of German and British and the American brands. The crisis in the Middle East and the disturbance in the currency. Every day it will get higher unless even you fix its price in US dollar. In Middle East it gets raised every day on. So I need to buy it now before next year, because next year it will be much more expensive. So it's pricing.
Gotcha.
I know you are doing your best for pricing and you make a lot of things affordable now.
Yes.
But you have to consider it in the microscope, especially.
Yeah. I understand maybe this part is, I fully agree with that about the price issue. And actually you see that even with all the price that you are keep using the microscope to deliver the good clinical result. So you have the, I think for you it's always like quality first.
Yeah.
But on the same time you need to try to reduce the cost. And that's what we do.
Let me tell you something. Something I liked in Peter regarding the dental scanner.
Okay.
The Smile Scan 2 price in Egypt is amazing.
Okay.
It make everyone seeking for it because of its price.
Okay.
While it doesn't downgrade the quality.
Okay. Exactly.
That's what I'm saying. He started to to do all of the part on Woodpecker and KB factory, so it became more cheaper from buying it. So he can provide it with good quality and the lower price. Now Smile Scan 2 is the lowest price in Egypt of scanners and not bad scanner.
Right.
This is very amazing. I'm using it. It's amazing scanner.
Exactly.
So that's what I'm saying about the microscope. The quality is very important, and this is this equation. I know it is hard, but this is the heart of Woodpecker. This is Mr. Wo vision, and to provide a high quality with affordable price. So I think I'm not saying something that is hard for you. I think this is your philosophy.
Exactly. Yeah, like you said, this is always our philosophy that try to make the quality same as say Europe or brand and keep the price affordable. Yeah. Thank you.
Thank you.
Okay, thanks. That's all for the interview today. Thanks for Dr.
Thank
Medhat.
you.
Thank you.